The fact that Canada has been the #1 country in the world for deaths in long-term care speaks volumes. We've had problems for decades about how we run long-term care homes, our infectious disease practices, but this pandemic's really brought it to the forefront. We've seen homes that have had huge mortality losses, and there's not a home that hasn't been affected. So we know that older adults, especially those living in long-term care, they need social interaction, they need exercise, they need physical activity, they need to eat as a group and have all those interactions. So we're also seeing a loneliness epidemic of people in long-term care. So there's both the direct loss of life, but also the declining in health that these people are suffering as a result of the lockdown measures for these infections.
COVID is a very complicated virus in terms of how it interacts with congregate care settings like long-term care. And so what the overarching goal of the study is to detangle all these complicating factors that are influencing outbreaks, infection by residents, illness, severe illness, as well as death.
I am just so excited with our participation rates. Our Schlegel Villages has been a major participant, as has St. Joseph's Villa. So we're looking at upwards of 23 homes across the province, including 2 from the north, that have agreed to participate. We're hoping to see 2,000 residents in the study and at least 2,000, if not more, essential visitors and staff members. They're going to help us because they're going to be providing saliva samples so we can track and understand how the infection's getting into these facilities and perhaps even prevent some of those infections.
The study is about 18 months. We've already started seeing results where our work is already using easily accessible or almost easily accessible provincial information to study spread and everything we can study with our information. And pretty quickly, in about 5-6 months or so, we should start to see some of the really detailed information that we're collecting in the study really contribute to the broader picture. And within 18 months, ourselves, as well as other allied studies, should really have a very much better sense about COVID risk, the ability of the vaccine to stave off severe infection, and what really the future looks like in terms of long-term care and safety.